So I'm sitting here with Dr. Shari, and we've known each other for many years now. So tell me how you got started with biofeedback.
Well, since year 2000, if you recall, I was doing my training with Adam.
That's Adam Crane.
Adam
right?
Crane, who is one of the major founders of neurobiofeedback in this country. And I was practicing out of Mexico. And my specialty was basically with kids, which you know. And over the past 12 years, I was doing all kinds of educational training and biofeedback and neurobiofeedback, and also another specialty that I have, which is art therapy, integrating the art therapy assessment within my biofeedback and neurobiofeedback practices.
And you have a book here.
Yes, I have a book that it just came out. It's published, it was June of this year, and it's called Symptoms, Stories, and the Evolving Child. And this book has 25 years of my practice with different populations from 4 years old to 16 to 18 years old kids.
Wow.
And also orphan population, also very, very special gifted children, you know, that needed to be treated, especially for ADD, ADHD. I have treated cases of asthma, allergies, insomnia, enuresis, Raynaud's syndrome, all sorts of different specialty cases, you know. And now I am presently working out of Mexico for the government. I am appointed ambassador for the children of Mexico.
Wow.
Because I've treated thousands of children since
Thousands?
the year 2000.
Wow.
I have treated thousands of children. And one of my major studies was with heart rate variability and ADD kids in an elementary school. I did that study for 6 months. I put a heart rate, variability clinic within the school, so they had their own classroom, and the kids would go in and train on the computers for 3 times a week, like 10 to 15 minutes.
And how many children were in this
There
study?
were 378 children in the study. And then I recently did a program for the government, bringing 100 children using music, art, and somatic training with this group of kids who are from a low socioeconomic status, classified 7D with the government.
Wow.
That 7 criteria stands for low consciousness of poverty. They're below poverty line. Drug abuse, alcohol abuse, family abuse, delinquency, drug trafficking, and also vandalism.
Wow. And did the government help to fund the program?
Yes, the government helped fund the program. They supported what I proposed to them, and June of this year, last year, 2011, we brought 100 children that we had formed an orchestra, school orchestra, and actually the results are being presented tomorrow at the AAPB conference, the one that you're here now and I'm here.
Right.
So we're going to present the results, the scientifically based results on the program. And so it's going to be a very interesting study because there's never been a study done like this before.
Right.
You know, so my belief in biofeedback and neurobiofeedback practices, especially with children, it's really, really intense. You know, I believe that this is some technique that should be applied more in the schools and other places, and people should get to know it more. So hopefully, if you have any questions or if you need me to give you any feedback, you know, like biofeedback, I'd be more than happy to do so.
Okay, and if anybody wants to find out more about your work, how might they find out about that?
Well, they
First
can
of all,
go
the
on,
book.
yeah, they
is-
can go on my website,
Okay.
www.shari-services.com.
Okay.
And they can click on that, and then there's also another site, which is drsharistressrelief.com.
Okay.
So they can go on those two sites and look it up and then email me.
All right, and what
There's info.
I'll also put a link
Sure.
at the end of the video so people can get it that way too.
Sure, and
Yes.
then there are also videotapes that they could request that I could send them on
Right.
any kind of training that they need, like training how the kids were developed. For
Right.
instance, we have one, and what kids are doing now in Mexico, there are
Right.
thousands.
Right.
So it could be helpful to whatever they're doing in there.
And where's the book available?
Oh, the book is available. They can contact me directly, and I can send them.
Okay.
It's not sold in the Amazon.com because it was out of Sonoma State University, and
Right.
I manage it myself.
Okay.
Yes.
Self,
Yeah, in the back of the book is there.
Great. Okay, so we'll just put the book up one more time. And
Yes.
it's great talking to you. And I'm sure there's a lot of children that will grow up healthier and in better shape than they would have without you. So I'm
Thank
glad.
you very much.
You're welcome.
Yeah, thank you.
All right.
All right.